The truth is, firefighters aren't struggling because they're weak. They're struggling because the system has never given them the same operational framework for mental health that it gives to them for other hazards. I wanted to build a model that fits the culture of the fire service. If trauma were a chemical, we treat it like an exposure problem. It gives departments a way to recognize patterns, track exposures, intervene early, not with punishment, but with support. I want the departments to understand that firefighters don't fail mentally. I think systems fail to monitor exposure. It isn't about fixing firefighters. It's about fixing how we track what the job does to them.
Welcome to Responder Resilience, along with Bonnie Rumley, LCSW EMT. I'm David Dashinger. Our guest today is Christopher Velasquez. We're going to be talking to him about his book, Firefighter Mental Health Exposure Program, a data-driven framework for wellness and resilience. It's going to focus on how repeated exposure to trauma silently affects firefighters and EMS professionals, and it offers a practical, data-driven way for departments to recognize, track, and reduce that impact before it leads to burnout, injury, and loss. We invite you to like and subscribe, YouTube, Responder Resilience, Facebook, Responder TV, LinkedIn, Apple Podcasts, Spotify, and go to our website, respondertv.com, for past episodes and guest information. And we'll be right back to speak with Chris after this.
Ask a first responder who they are, and you're likely to hear,
I am a police officer.
I am a firefighter.
I am a paramedic.
I am a 911 communications operator.
not I do this work, but I am this job. Ask a clinician why they work with first responders, and they may say,
There's no higher calling than helping the helpers.
join us in shaping a culture where mental health, wellness, and leadership are prioritized, not whispered about, where support is a sign of strength, not failure, and where no one has to carry the weight alone. Welcome to Responder Resilience. We shine a spotlight on the unseen battles of first responder reality and celebrate the powerful wins that come from the grit of post-traumatic growth. We understand the culture, honor the trust, and bring you conversations from the change makers, passionate about helping first responders come home whole.
With your hosts, Retired Lieutenant David Dashinger, Dr. Stacy Raymond, and Bonnie Rumley, LCSW EMT.
Our guest today is Christopher P. Velasquez. He's a veteran firefighter, paramedic, public safety leader, and healthcare innovator with more than 30 years of experience across fire suppression, emergency medical services, training, and mobile integrated healthcare. Throughout his career, Chris has served in operational leadership and advisory roles, responding to high acuity emergencies while helping shape system-level approaches to responder health and resilience. Chris is the author of Firefighter Mental Health Exposure Program, a data-driven framework for wellness and resilience. And it's a book that presents a practical, prevention-focused model for recognizing and managing cumulative mental health exposure among fire and EMS professionals, treating psychological risk with the same operational vigor as physical safety. Christopher, a warm welcome to Responder Resilience.
Thank you. Thank you for having me on.
Chris, it's great to meet you. David's told me a lot about you, so thanks for spending some time with us this morning.
No, thank you.
I feel like we always start these with almost the same sentence, so I try to change it up each time. But we're really excited just to hear about your experience and your background in fire and EMS. Can you walk us through the beginning of your career and where you headed from there?
Yes, yeah. So thanks again for having me on. My name is Christopher Velasquez. I've spent my career in the fire and EMS world, decades of calls, disasters, long nights, and the kind of experiences that don't always leave visible scars. That's really why I wrote the Firefighter Mental Health Exposure Manual or program. I call it a manual because it doesn't really feel like a book. It's really 50 pages long, and I kept it short intentionally because I know my audience. Anyway, in the fire service, we're trained to measure everything. We track air quality, carcinogen exposure, hose friction loss, radio traffic, turnout times, you name it. There is a metric for it. But when it comes to the one thing that consistently ends careers and takes lives, cumulative trauma exposure, we've never had a structured way to measure it. We leave it up to chance, personality, or whether someone feels comfortable speaking up. And the truth is, firefighters aren't struggling because they're weak. They're struggling because the system has never given them the same operational framework for mental health that it gives to them for other hazards, carcinogens and, everything of that sort. If trauma were a chemical, we'd treat it like an exposure problem. Mm-hmm. If it were a mechanical issue, we'd install safeguards. But because it's psychological and it's our mental health, we often wait until someone is already in crisis before they even act. And that's what this book is about. It's about changing that paradigm, that response. I wanted to build a model that fits the culture of the fire service. Mm-hmm. Again, this is applicable to every, police, fire, EMS. It's applicable to all public service, and even beyond that. And we could talk about that a little more. But it's something that's data driven. It's practical. It's very respectable of privacy. A system that it helps identify early warning signs long before someone hits their breaking point. Something that even police officers could use, firefighters can trust, and departments can implement without the stigma or judgment. At its core, the Firefighter Mental Health Exposure Program reframes trauma as an operational reality rather than a personal flaw. It gives departments a way to recognize patterns, track exposures, intervene early, not with punishment, but with support. Firefighters show up for everyone else. This framework helps departments finally show up for them. And we can change how we understand exposure once we start measuring it. And again, it's not just for the fire service, and we can change the trajectory of future public safety.
Well, that's an incredible explanation, Chris. And I think you highlighted something that's really important, and that's sort of the recognition of when someone's struggling, right? We may have officers that are better at just noticing that someone's off or they're struggling, and others maybe not so much, right? It's not something we're typically trained on or given like even awareness level training on. Was there a moment in your career where it was kind of like an aha moment or a pivotal moment when you realized there was a need for this?
Actually, no, David. It was when I retired. So really the big push, I think, for my retirement was a lot of therapy. And I can't really speak for other responders because this is such a bad stigma right now in the fire department, in the public safety realm. We don't talk, there's maybe more discussion now that I've seen in the last 3 years, believe it or not. Mm-hmm. But when I was in, I entered the fire service in 1995. You didn't talk about these things, right? We kept it to ourselves. We had drinks with the guys, and that was it. Mm-hmm. But it was probably, I went through a few, and I tell everybody, just go to therapy, right? I went to PhDs, MDs, LPCs, and honestly, the one that I really connected with was a licensed professional counselor. He was kind of a very unconventional, not someone that I would clearly identify if you saw him walking on the street. And that's just testament to me, just where I was at the point. I was like, I'm willing to talk to anybody at this point. Good thing is I had a really good support structure at home. My wife, my children, my daughters. They're adult. They were adults at the point, but they're very supportive, and they knew way before me that something was wrong. Of course, again, there's that disconnect with the fire service. Had there been some kind of way for my wife to interject to the fire service and say, "Hey, is there any way to get my husband help?" And there really wasn't. There's no dialogue opening, and that's something I touch on the second book. Is how do we involve the family in this care, And it was after a lot of therapy, David, and I realized I was broken after I got fixed, if that makes sense. I don't know if that really makes sense.
Okay.
It does make sense because we've been fixed in our own ways too. So it absolutely makes sense.
Not everyone is meant to walk this path, and that's okay. But for those who feel the call, for those who read these words and feel not just curiosity, but conviction, know this. By the time a first responder sits across from you, they've likely exhausted every internal resource they have. This isn't a routine appointment, it's their 911 call.
I don't know how much longer I can do this job.
You won't hear sirens, but the urgency is real. If you choose to take that call, understand what it means. To show up, to stay steady, and to carry the weight of someone who spent a career doing the same for others. This is where the work begins. Be the resource they can count on. Order your copy of Helping the Helpers today on Amazon, and for bulk orders, email us at info@respondertv.com.
You said something interesting there, that there's no feedback loop with spouses, significant others, family, and the workplace. And you're absolutely right. You know, we see that in our therapy office all the time. And for first responders who work with clinicians, but really more importantly, the clinicians working with first responders should be aware of the fact that you need the spouse, you need the family involved in their treatment, because it's technically a lot of the time when the family calls us when something is wrong. It's not always the responder. So I agree with the point you're making about a feedback loop is really, really important. And I think that the reason departments and agencies shy away from that is they're scared of the liability. They're scared of when they get a phone call from a wife, they don't know what to do. They don't have the structure in place. And how you're describing your manual as an SOP for mental health, it makes complete sense. And I was wondering if you have gotten good reception. Do you feel like people are more open to using your manual when you frame it in such a way as this is an SOP like everything else would be?
Yes, Bonnie. It's interesting you brought that up, because I put this out. I write a lot. I've always written a lot, even as a young man. Right, I just write, and I like I told David, I'm not one of the cool kids, right, in the fire department. I wasn't. I've always been this little chubby, thick glasses, reading books all the time. And I didn't really fit the, the firefighter kind of calendar kind of guy, right? And don't get me wrong, I was in it. I was in the deep of it. I was in the stuff. I loved it. I loved the response. I loved the hurricanes, everything. And I did, when I published this, and of course my wife shared it with her social media, and then it kind of just took off. Like it was amazing to me, especially with our local firefighters reaching out to me, and I wanted to make it clear to them that, because they were private messaging, texting me, calling me. I've had the same phone number for 20 years, and they were really like, "Wow, I'm struggling. Does this book help us give direction?" And I felt bad, because I was like, "Whoa, they really want to know how to fix themselves." And I was like, "Guys, please understand, this is not a book that it's not a self-help book, right?" Because they see me, and I think they think I'm a success story, but they didn't see me when I was on the bottom, right, on the floor, falling, and my wife picking me up, right? But that's good. I'm glad, but I didn't realize so many guys, or so many and a couple of women, right, they're firefighters, they're hurting, and I didn't realize it. Even young ones, like I had just recently got one of them reach out to me, 5 years in the department, and with the book, I intentionally avoid framing mental health as toughness or weakness, right? I want to treat trauma like any other occupational exposure. And it is, in my opinion, again, this is my opinion, I'm not a PhD or anything. It's very predictable, and it's very manageable. We could help direct future assignments, future breaks, future vacations based off these measures, right? And I want the departments to understand that firefighters don't fail mentally. I think systems fail to monitor exposure. I think we just treat it like, hey, it's just what it is, right? And that's really not. It really isn't what it is, right? I don't think it isn't about fixing firefighters. It's about fixing how we track what the job does to them.
Mm-hmm.
Can you get a little deeper into that? So, as you mentioned earlier, we track certain things, that are much more traditional, I guess, in our work, whether it's EMS or fire, that are quantifiable, or if someone is working in a radiation, suite at a radiologist's office, they have a badge that shows how much exposure they've had to radiation, and we know that we have to get them an intervention when it's getting too high into that, that dosage. With what we do with the mental health piece of it, what are some of the tangible things that can be tracked that would give us some, useful information so we can give someone help and resources when they need it?
Yeah, and great point, David. I'm glad you brought that up because the program introduces structured exposure tracking instead of just subjective check-ins, right? I mean, awareness is great. Don't get me wrong. I am not slamming any. This is not about this is better or that's failing. We're starting somewhere, and awareness is great, but without structure, I think. And again, I hate saying this because I don't want to hurt anybody's feelings, but without structure, awareness is just noise, and I don't know if that's even the right way to phrase that, but I want to allow I want to align how the fire departments already think with metrics and thresholds and trends, right? They measure turnout times and everything like that. And what this becomes is operational intelligence, and this is not a personal like what I believe. It's true, right? We know that certain runs carry certain weights and they present certain traumas, right? So let's just say I don't want to use Bonnie and David as examples, right? You're two paramedics on an ambulance, and me, Chris and John are on another ambulance, right? We could have the same run volume. We could each have 10 runs for that shift, but David and Bonnie could have 5 cardiac arrests. Christopher and John could have 5 cancels. So therein lies the truth of the operational intelligence, right? Scores it's a weighted score. So, and again, it's really up to the department. It's not just about urban departments. It could be rural departments because you let the department decide what that score would be. So your score at the end of a month, say David and Bonnie's EMS score could be 100, and Chris and John is 5. Well, maybe that's a good operational threshold to say, hey, you know what, we're going to switch the location because it's not fair just because David and Bonnie just got an EMS or got into the fire department that they're just going to stay there and get beat up, constantly. Let's switch their location. Let's switch their shift, or let's give them a floating vacation day if that's something there's just so many ways that this tangent can grow into, again, that operational intelligence. As a leader, you can decide, and firefighters, if we can quantify that data, they trust data. We do, right? And I think all public safety responders trust data. So I want to build this model to something that caters or speaks to their language, and that's, like, leadership responsibility is a big deal though, as far as how this plays out.
Boxing has the power to change lives, especially for first responders. Fight Camp embraces your journey, whether you're stepping into the ring for the first time, returning after a break, or aiming to elevate your fitness. Harness the strength of boxing to release stress, build resilience, and connect with a supportive community, one punch at a time. Use code RR10 for a 10% discount on Fight Camp packages and accessories. Go to joinfightcamp.com/shop.
I'm wondering what you see as the barriers to this, because it sounds simple, right? It sounds like, okay, we roll out a plan on how we're going to track the data, we get the data, and then we use it to inform our practices and how we're going to implement strategies for our people. So what are the obstacles there? Is it money? Is it time? Like, what are you hearing from people as to why they don't do these things?
I've had the opportunity to speak with chiefs from several big departments. They've reached out to me actually post publication, and then we sat down for lunch and discussions. And one of them was a bit of a drive, but I'm really, this is very, it's in my heart. I really want this to get out there. I want it to gain momentum. And I think some of the barriers are, Bonnie, is what do we do with this, right? As a leader, as an administrator, okay, great. Chris is at the threshold of breaking. His score last month was 100. What do you want me to do with this? Put him off, make him go to therapy? And again, this is where it gets tricky, right? And that's where I'm in the second book, because this is a 3-book series, and it was always going to be intentional, right? The first book was just to get you hooked, to get you interested and talking. The second book is really, really aimed at leadership. And in leadership, I don't want just the everyday firefighter police officer to think, this is for my captain, I don't want to be engaged with this. No, because it really will hold them accountable. Because if you're on the ground floor, if you're a paramedic on the ambulance, And if they're making this program applicable to their fire department, then you should know the steps the leadership should be taking. And again, it reframes the mental health as as leadership and a policy issue, not an individual burden. And chief officers, they already manage risk, and this just adds one more exposure category that they should be measuring because, if let's just take it on the flip side, my wife, if she would have had a way to reach out to someone and they help intervene, but what if I didn't? What if I didn't have my wife, or what if my wife didn't know what to do? And let's just say, God forbid, I took my own life. Should that be any different than if I was exposed to some carcinogen and they didn't tell her? That kind of it just to shift that paradigm and that stigma, to get away from just saying, oh, it's just personal weakness, or you're just you're just whining. We gotta get rid of that stigma and treat it like a true exposure category. And to your point, I think it's money, Bonnie. Honestly, I think money is what happens next, right? And it's really not that complicated.
Well, here's what I'm thinking. Like, do we get better at trying to cut the head off the snake with these issues in police, fire, EMS, in all branches? And what I mean by that is, do we take this information to the town planners, to the select people, and say, look, if you want to save money on the back end of people being out of work or you paying for exorbitant insurance bills, this is the way to get ahead of that, because those people are the ones that are looking at the dollars and cents the most, right? So if we could educate them that there actually is a savings of human life, which is obviously the most important to us, but I think we have to be better at speaking those languages of finances. Like
could we reduce? There's going to be so many intangibles and ripple effects if we start measuring this like a real risk category. And what I mean by that is, I called in sick all the time. So if there was something early in my career, how much money in overtime could I save the city by not calling off sick? And honestly, I never called off sick when I was actually sick. When I was sick, I went to work. When I was well, I called in sick to go fishing or whatever. And you're right. There's going to be some tangibles that we can measure down the road, right? Ripple effects, if you will, for cost effectiveness, cost savings, cost avoidance, really.
Mm-hmm. Yeah. And so let's jump into the tech piece of this. What are your thoughts in terms of like monitoring systems, technology out there that can kind of have a beat on the responders' stress level, cumulative trauma, and give us some data that could be relatable and accessible?
So, good point. Yes, and this fits into real life fire department operations today as it operates. So this is not like something that you have to reinvent or buy this new CAD system for millions of dollars, right? It's designed to integrate with existing reporting, training, and other wellness programs. It's very scalable from small volunteer departments to large urban departments. And the biggest thing is the biggest message I want really the responders to understand that this is not going to be introduced into forced therapy or mandatory confessions on the scene. It's just an early detection, right? This is just an early detection, and that's where it gets real sketchy. How we measure this, and I'll pick on San Antonio Fire Department, right? Because that's where I grew up. I mean, I entered as a young man. I was 21 years old, and I retired when I was 50. So when we have a software, and it's a big software company, and they're nationwide, and a lot of departments use it. Fire departments, police departments, there's even private equity firms that use this software, right? Which is interesting to me, right? Because I thought it was just it's just for firefighters. It really isn't. And I've spoken to the president of this company, a CEO. His name is Todd Stout. And I've spoken to many members of this team, and this is very, very doable with existing infrastructure. He literally said it would be nothing just to create a new measure, turn on a new switch. And what First Watch is, it's a data analytics software that most fire departments use to measure response. And right now it's very patient driven. And I learned how to use First Watch because when I was the program director for the mobile integrated healthcare program in the city of San Antonio, I used First Watch exclusively because it was so intelligent, because you can monitor runs on the fly. You can literally monitor a run while it's on the go before the case gets closed out. And I used it with frequent callers, right? And I was able to leverage their software in a way that I could monitor patients that were frequently calling. And excuse me, what I was able to prove through their software was I was able to resolve the top 100 EMS call 911 callers and reduce their call volume by 70 to 80%. I think I want to say the number was 78% actually. And when I sold the mobile integrated healthcare concept to city council, I told them I could reduce the run volume by 10%. And when I looked at the first, 6 months, I was like, whoa, this can't be real. I triple checked, I quadruple checked the data, and it was right. And what it would be is so First Watch, I'll give you a little quick example, David, if that's, so
Yes.
What it is Chris Velasquez lives at 123 Park Avenue. Anytime Chris Velasquez would call 911, if I can go into First Watch and I can set up a monitoring measure, and it could either send you a text message or an email, and this is First Watch. I could tell First Watch, you log in and it says, I want to know every time Chris Velasquez calls 911 starting from today. And it'll send me an email, say, hey, just FYI, yesterday at 4:30 a.m., Chris Velasquez called 911. Like, okay, let me check in on him. So that's how we would get ahead of those next calls. We wouldn't wait for the next call. If a call happened, we'd like to know about it because we want to know where they were transported, why they were transported. But it would give us a good indicator to say, if Chris called 10 times last month, let's not wait for 11 times. Let's go knock on his door in a non-emergent response, and let's just figure out what the need is, right? So when I talked to Todd about this concept, and he read the book, he goes, oh my God, I want more. He goes, let's talk. And I'm like, great. Because, when you write these things, there's a lot of self-doubt, right? And I think everybody has a little bit of degree of self-doubt. And I did, right? And I was like, is this just dumb? Is this just like a dumb idea? I don't know. So Todd, I sent him a copy, crickets, right? I didn't hear nothing from Todd for a couple of months. And I was like, I guess it's just not a good idea. And then out of the blue, he calls me and he's like, hey, I just read your book. We need to get on this. Like, yesterday. And I was like, wow, okay, good. That's good to know. So it gave me that sense of validation. Then Dave read it and Tracy, and I was like, okay, good. I'm not just imagining, this is a good thing. But so First Watch can do these measures. I talked to Todd and he's like, yeah. I said, so can we do this for paramedics? Can we just switch it from the patient to the paramedic and monitor what these runs are and scale it and number it and weight it? And he was like, absolutely. That's easy. We can do that. We can do that easily. And anyone that has a software will be willing to turn it on today. And I was like, wow, that's I said, well, how about if it's someone that doesn't have the software? He goes, circle back with me. And if you find a department that wants to try this, like a pilot program, he goes, let's try it out. And what Todd was really interested is pairing his software, First Watch, with a wearable, with not necessarily an Apple Watch, but with something that we can the responders can wear for whatever we do, a project, a pilot program, something to that degree, so we can see if there's an intersection between real life physical stress and the mental trauma that they're exposed to, which we know there is, right? Anecdotally we know that, but can we prove it through real physiological changes?
She fulfilled a promise that was made to her husband and donated his organs so others could live. 5 lives were saved in the process.
He always did what was better for other people instead of himself. I would definitely consider my dad a hero.
Getting the word out there, still saving lives.
Actually, their help helped my parents to be able to get me a car so I could definitely get to dialysis.
I heard about you and I'm going to help you. They saved my life.
Be a forever hero. Donate life.
Well, it's such a neat concept that you're bringing up. And we all know the frequent flyer situation. And I don't know about you, but in my experience, the frequent flyers were largely due to psychological issues, either anxiety, loneliness, depression. And to your point, if you can even get ahead of those things, not even just with your people, but with the general public, and call your social services department and say, hey, I have somebody who could use a live-in nurse. And that goes to kind of the mobile health care and more of the preventative aspect of EMS, which is really incredible. I was wondering about using the system for flagging priority 1 calls because, as you know, there's a lot of cardiac arrests, but it would be great if admin or a supervisor or the head of peer support got a heads up, hey, 1 a.m. last night, there was a pediatric cardiac arrest. And that would allow for planning of a CISD and for getting your appropriate resources in play. Have you seen it be used for that kind of a thing yet, or any thoughts on that?
In 2019, we heard about COVID, right? And we didn't think COVID was here, but we know now it was here. We know COVID was here way before we actually knew it was here. But we had COVID alerts. So, yeah, we used it in that. And do you remember the Ebola crisis that never happened?
I do.
Yes. So we had Ebola alerts. So anyone that was traveling recently and had a fever, the fail point, it's very, the cautionary tale, and I'm going to pick on Ebola alert, right? And it was it got comical. It really did, because I knew. So if you know, the first real case in the U.S., I believe, was in Dallas, Texas. It was someone who recently traveled from East Africa or West Africa. I forget which. I know they're two totally different, but let's just say they came in from I think it was West Africa, and this person was in an apartment with 2 people, and he was projectile vomiting, and so he called EMS, rightfully so. They picked him up, they took him to the hospital, and the nurse ended up converting and getting the nurse at the facility got COVID or Ebola. The 2 paramedics did not get Ebola, right? And I know, and I'm not slamming Dallas Fire because we're all the same. And Dave, you were there, and I don't know, Bonnie, if you were ever on an EMS unit. We're not exactly aseptic, if you will. So when the paramedics did not convert, I was like, I know these guys did not wipe down that ambulance so I knew then it wasn't as contagious as we believed it to be. So when they started a COVID unit, of course, I raised my hand. I was like, yeah, I'll get on there, because I was like, this is not going to materialize. But I was just real curious, right? Of course, my wife, it drives her nuts. She goes, we're on the Ebola unit. Everybody has Ebola, right? But we never even actually had a case here in San Antonio, but we had a lot of Ebola responses. So anyone that was, with a fever, and it elicited, and we used First Watch for that. So it was really good at catching that, because then it would alert the administrators to say, okay, we got this patient is, recently traveled from out of the country, but then it started from, West Africa, then it turned into anyone that recently traveled with a fever. That's what the paramedics turned it into, right? And then it was like, where were you recently traveled? Oh, I was I went to my hometown, which is 30 miles south of here. Okay, well, that's not Ebola, right? You have the flu anyway. So it was, yes. So to your question, Bonnie, I'm sorry, I get off these tangents. We used the First Watch, and we still use it today for stuff like this. And they use it for cardiac arrest even today, because they do the QA/QI process with the medical director's office to make sure that all the steps were followed and everything like that. Yes.
I'm going to have you look into your crystal ball, and let's say, fast forward a couple of years, what would this look like? The vision you have of how this would be changing the game for mental health and emergency services. Kind of run us through your, dream scenario of how this would all play out.
I think the ultimate goal would keep people healthy long enough to finish strong. I think the fire service is where my heart is always at. It's always going to be. But I think we could do that for all the responders to create more resilient team members. And I don't think we need tougher responders per se. I think we just need smarter systems. And we need to shift it from reactive wellness to preventative design, if that's a way to phrase it. Yeah, and this framework isn't limited. Like I said, it's not limited to firefighters. It could be. Trust me, I can go on and on about this stuff, but it could be law enforcement, healthcare workers, nurses, even LPCs, if you want to look at it that way, because you can. Because I mean, I used to see this line of people waiting for the next, and I used to think about my counselor, and I'm like, wow, he must. At the end of the day, I can't even imagine what is going on with his head, right? I'm one personality. He's got 10 more to deal with. And I used to actually feel sorry for my counselor. I was like, wow, this guy, he's legit. Like, he does this every day, you know? So again, we need to start treating it like, again, and I want to keep pounding this on, but we need to keep it with the same seriousness that we treat physical safety. We just need to deal with. There's not going to be fewer crises. We know that, right? But I think earlier conversations, earlier interventions, it connotates to longer careers and healthier careers.
Well, you have a great message, and I want to tell you that that book was not written for nothing. I mean, I think that the man that you described having the 2-month gap was because it probably blew his mind, and he was trying to figure out how he could use it and implement it because it was so smart. So I hope you keep going and take those risks and put your ideas out there. And you never know who's going to be listening or watching this podcast today too. You may have sparked something in someone. And so for that, we're really, really grateful. And it's been wonderful to meet you. Thank you for your time.
Thank you. Thank y'all for having me.
Yeah, Chris, and let us know where can people find your book and any contacts you want to share, social media, website, all that good stuff.
Yeah, so you can find it on Amazon, the Firefighter Mental Health Exposure Program. And if you just, if you go to Amazon, you type Firefighter Mental Health, it's going to be one of the top ones that pop up there. But I do want people to understand this is not a self-help book. Not that I'm knocking those books. I love those. I've read a few of those. This is not, if you're looking for ways to attack therapy and personal stuff, this is not the book for you. This is more geared towards, if you want to implement this into your system, this is what, you would start with. If anyone is out there wanting to start a conversation, I don't charge for these discussions. I love them. I'm retired. I'm frequently bored. So I'm always looking for, I don't charge. I want to help build this out. So there's a department out there listening that really wants to get this started. Please contact me, info@mobilehealthconcepts.com. It's just info@mobilehealthconcepts.com, or they can, reach me through you, Dave, and I'm sure you could forward me their email and stuff like that. My contact information is on my LinkedIn, Christopher Velasquez. You want to connect, I'll connect with anyone there as well. I do have a website, mobilehealthconcepts.com, but again, it's in transition from GoDaddy to another server right now, so it's not operational. But anyway, thank you again, both y'all. And again, the title of the book is the Firefighter Mental Health Exposure Program.
Yeah, well, it's absolutely a pleasure to have this conversation with you. And what you're doing, I think, is going to be a game changer as it evolves forward. And I do value you as a collaborator. I think that's really important quality in today's world, where it's not about us versus them. We're all in this together on the same team. So I appreciate you for all of that and for sharing your time today with us.
Thank y'all for having me. Appreciate you.
Remember to like and subscribe. YouTube, Responder Resilience. Facebook, Responder TV. We're on LinkedIn, Apple Podcasts, Spotify, and go to our website, respondertv.com, for past episodes and guest information. Till the next time, stay safe, be kind to yourself. Take care.